More than 11,000 complaints were filed in California with the Equal Employment Opportunity Commission last year. Some employees accused of boundary crossing behavior must attend remediation programs to keep their job. Here with some insight on how one such program works is Elizabeth Becker, licensed clinical social worker and creator of the original Professional Boundaries program here in San Diego. Welcome.
Thank you.
Now, tell us about this program. What kind of behavior gets you into your program?
There's a range of unprofessional conduct, everything ranging from inappropriate comments to sexual misconduct, including sexual harassment, can cause a person to be referred to our program.
And who's there? This is for professionals, for doctors?
The focus is primarily on the healthcare industry, so we see physicians, we do see nurses, we also see dentists, therapists, mostly people in the healthcare industry who hold a license.
Professional Boundaries is a remediation program. How is that different from, let's say, a therapy program?
Well, treatment programs are really designed to address somebody who's been identified as having behavior that's driven or highly influenced by some sort of psychopathology. So they've been given some sort of diagnosis. And remediation is more of an education and training program that's used to correct behavior that is not necessarily secondary to some sort of psychiatric impairment.
Within this program, boundary crossing is differentiated, let's say, from harassment. How do they differ?
Not a whole lot.
Okay.
Boundary crossings is a kind of a generic term, and sexual harassment falls within that category of a boundary crossing or a boundary violation. So there, if you were to think of boundary violations as having a range, sexual harassment would be on the higher end of that range, and maybe something like a dual relationship would be at the lower end of that boundary crossing range.
And you have a couple of examples. Let's say physicians may be doing some inappropriate things. Is that involve the touch, or does that go into sexual harassment?
Well, it depends on what kind of physician you're talking about. So psychiatry, OBGYNs, people who, physicians who have a lot of patients where there's either a great deal of disrobing from the waist down involved versus a surgeon or another kind of physician who wouldn't have access to a patient in that way.
Let's get into the workshop. Actually, it's a 3-day, I believe, psychoeducational course. That's what you call it. What are sort of the steps and components? What can you do in 3 days?
Well, what we began to do is first to educate them. The primary focus of the program is to get them to take a look at themselves and the things that influence their behavior. So we're looking at both their cognitive thought process as well as how that thinking process triggers their behavior or causes them to make certain decisions. We do a brief screening at the beginning. It's not a full evaluation, but we do look to see whether or not there's any other components or factors that are contributing to their potential misconduct. And so we start on the first day by having them take a look at what's going on inside of them, the way they think about things, their values and beliefs. And then the second day we have them look at their behavior, how that translates into what they do or don't do. And then on the third day we work with them to develop a commitment to change contract, and that is basically how things are going to be different once they enter the program.
How they can take what they have learned.
Yes.
There's a lot more about that on our website. People can talk about, they can find out a whole lot more about the actual program. But I wanted to ask you, what if somebody has a mental health issue? What if it's truly that this is some sort of episode that's a mental health? What do you do then?
Well, first of all, we try to identify what that is, and then we make referrals for them. So we make sure that if alcohol or drugs are a factor, or if there's marital stress or any kind of other life event or anxiety that's contributing to their behavior, we make sure that they get hooked up with the people who can provide them with the full range of care.
What's your success rate?
Our success rate is highly dependent upon how motivated they are and the follow-up program. The follow-up program is really important because that's the place where we have an opportunity to provide them with ongoing support, and that's what Mr. Filner is going to need. He's going to need ongoing support and treatment throughout this process in order to have a full success.
All right, Elizabeth Becker with Inner Solutions for Success. Thank you so much.
Thank you.